Hello, my name is Shelley French. I'm Head of Pharmacy Technician Development at Barts Health. I'm a registered pharmacy technician.
Hello, my name is Shital Jogia and I'm a registered pharmacy technician by background. I'm the head of education and training at Barts Health Pharmaceutical, which is a licensed manufacturing unit at Barts Health NHS Trust. Shelley French and I work together to develop and implement a strategy for training pharmacy support staff. In June 2019, the General Pharmaceutical Council updated its minimum standards for pharmacy support staff. For Barts Health, we carried out a scoping exercise to identify where the gaps were. The outcome of the scoping exercise identified different needs for the main pharmacy and the manufacturing unit.
From the scoping exercise, the following needs were identified. The GPHC standards were being met in main pharmacy, but on an ad hoc basis with no strategy or control on the amount of trainees we had at any one time. We needed to identify a clear strategy for ensuring all pharmacy support staff had the correct qualifications, skills and behaviours to deliver our operational services for both main pharmacy and the manufacturing unit. While Sheetal worked on ensuring the legacy staff were meeting the GPHC standards, a proposal was written to develop a cohort of trainee pharmacy assistants to ensure a robust system to recruit, train and retain pharmacy support staff, allowing a steady stream of pharmacy assistants who meet the GPHC requirements qualifying every 15 months. The proposal was signed off at Pharmacy Management Board and covered key points. We agreed a pay scale for the trainee pharmacy assistants. This was agreed to use Agenda for Change Annex 21. We created a new Band 6 Pharmacy Technician Education Supervisor role to manage, organise and coordinate the cohort. We were part of the Pan-London procurement panel to procure a provider to deliver the MVQ training programme. Once the providers were identified, this enabled us to work with the approved provider under the procurement contract and access the apprenticeship levy funds to pay for the course. We also created a clear career pathway for pharmacy support staff to retain staff within the department.
Following the scoping exercise, the next step was to write a proposal paper for training legacy staff within the manufacturing unit. The training would have to be in phases to ensure that the needs of the service were not compromised and adequate support was provided for all the learners. After the proposal paper was signed off by the Deputy Chief Pharmacist and agreed with all the major stakeholders, the final step was to carry out enrolment with the chosen education providers. That was either apprenticeships or buttercups, which was distance learning. The manufacturing unit was at 3 sites: aseptic services unit at Royal London Hospital, chemotherapy services unit at the Barts and pre-packing service at the Whipps Cross Hospital. And relevant staff within the 3 units needed to be enrolled in different training programs based on their area of work. The pre-packing unit staff were enrolled on the stores unit, whereas the production staff were enrolled on manufacturing unit with Buttercups program. All the Band 2 staff were enrolled on the apprenticeship program with the levy to bring them in line with the rest of the pharmacy. Since enrollment, we have enrolled 12 members of staff on the apprenticeship program and 12 on Buttercups, out of which 6 have completed the level 2 equivalent qualification for the stores unit. The remaining are progressing well and should complete their NVQ equivalent qualification or the apprenticeship by August 2021.
We currently have a cohort of 10 trainee pharmacy assistants rotating through all areas of pharmacy. This programme is currently going well and we've received positive feedback from the trainees.